I'm Dr. Kiran Chokha, sports medicine, joint replacement and orthopedic surgeon. I have been practicing sports medicine, arthroscopic surgeries, joint replacement surgeries since last 11 to 12 years. I have operated more than 4 to 5,000 surgeries. Among that, I have done more than 1,000 knee replacement surgeries. Today, I'm here to talk about joint replacement surgeries. Once the patient is decided, the day of surgery, we take the patient to the OT table, we give the anesthesia. Once anesthesia is given, we put up a tourniquet, a tape, which will block the blood supply to the part of the joint where we are operating. And after the anesthesia, the patient is made to feel comfortable, he will be lying down. Once we start the surgery, we cut the skin open. It will be around 6 to 8 inches. 6 inches is almost the standardized size of the incision. Once the incision is taken, we expose the joint. After the exposure, we'll evaluate how much the bone is damaged. We remove the excess bone which is grown, which we call it as osteophytes. We remove the osteophytes, we cut off the meniscus, we remove the ACL ligament. Then we balance the ligaments which are on the either side of the joint, which are called as medial collateral ligament and lateral collateral ligament. Then we cut the bone, the femur bone, that is thigh bone, as well as the tibia bone, that is called as leg bone. We cut at least approximately, we have certain measurements for that thing. We give a proper shape to the thigh bone as well as the leg bone. What I do is basically at the tibial side or the leg bone side, we remove a bone measuring about 2 mm. We give a proper shape, then we fix one metal cap for that thing, and in the same proper fashion on the thigh side, we give a proper shape, cutting only the damaged surface. It is not how people will think that it's not knee replacement, it is knee resurfacement. We only remove the surface which is damaged, that is the surface which is damaged, the bone, then we fix up a metal cap. This is the procedure involved in knee replacement surgery. Based on the type of joint replacement surgery we do, whether it is a single joint or the double joint, it is the both knee replaced, we take the post-op protocol. Usually what I do is I make my patients walk the same evening. That gives them the confidence. The second day I make them use the toilet by themselves. From the third day, when we change the dressing and put a waterproof dressing, they can even bathe themselves, they can walk around with the help of a walker. For 3 weeks, we don't allow them to use the stairs if both the knee replacements are done. In cases when we do a single joint, we allow them to climb stairs the second day. Post 3 weeks of surgery, we encourage the patients to climb the stairs, and even we encourage them to go for a walk at least 1 kilometer outside their house.